everybody. Welcome to Healthline. I am Gregory Zarian. And are you enjoying your spring? Spring turns into summer. So are you getting your health on? Are you outside with your family? Are you working out? Are you exercising? Are you closing the computer, taking a few deep breaths, and enjoying all that is outside? You know, one of my missions of doing this show is to bring you all you need to know about health and wellness, and also remind you to drink more water, to eat healthy, to eat more green food, to cut back on the sugar and the starches, and get your health on. The conversation today is all about stroke. And did you know, and you must know, that leading a healthy lifestyle can actually help you prevent stroke? Let me share with you some statistics that may pique more of your interest. Did you know that stroke is the third leading cause of death in the United States? And you know what? I'm actually going to correct myself because our guest corrected me in that. It's actually the fourth leading cause of death in the United States. And we're going to share with you why it's gone from 3 to 4. Over 140,000 people die every year from stroke. It is the leading cause of death in seniors, and over 795,000 people suffer from stroke each year. And did you know that stroke can actually happen to a child that is in vitro while a woman is pregnant? So to share with you everything you need to know about stroke, I decided to bring in the best of the best from Glendale Adventist Medical Center, the stroke medical director, Dr. Lance Lee. How are you, doctor?
Very good. Thanks for having me, Greg.
And we've been to this party before. You were on Healthline a couple of years ago, and I see you at all the events. You are the medical director of the Stroke Center at Glendale Adventist Medical Center, and it is the first certified stroke center in the community.
That is correct, yes.
Which is pretty exciting to say. And the first in the San Fernando Valley. Doctor, bottom line, what is stroke?
Well, stroke is when your brain does not get enough oxygen and sugar, which are really necessary for your brain to function. When things get interrupted like that, then you can get a brain damage.
Sugar, so our brains need sugar. So our body needs sugar. I know it needs a certain
Correct.
type of sugar. Does it need a lot of sugar for it to work?
Not really, but brain probably uses a lot of sugars in general.
In general?
Probably the most, it's the organ that uses sugar the most,
Okay.
I would say.
I'm just going to address the statistics we started off with. It used to be the third leading cause. It's now the fourth leading cause. How did we go from 3 to 4? What were doctors and what were we doing right to knock us down a peg? Because that's a big deal.
Well, there has been a lot of effort, of course, by the stroke community and doctors, and since we have invented a medication called TPA, which is a clot buster to treat the stroke patients, and also development of the stroke centers in the nationwide level, that really changed the, I guess, the entire picture of the mortality, this map. So the stroke became the fourth leading cause of death as of now.
So when you were at work one day and you're like, "Hey doctor, we dropped from 3 to 4." How did that make you feel? Because you're part of this conversation.
Yes, it really feels something that make you really strong. That you are doing something for the public and patient population, and it's actually a real big deal.
Well, congratulations for being part of that. So we're going to share more with you about the types of stroke. Dr. Lee made a comment about a map, and basically what happens is we all have vessels and streets that go to our brain, and a stroke is one of those streets gets blocked. We're going to share with you what TPA is, and I'm going to throw out some more statistics when we come back. So here's a favor. Get up, go get a glass of water, maybe pick up a carrot stick, put down the cigarette, bring in your family, and learn more about stroke. Don't go away. Welcome back to Healthline. I am Gregory Zarian, and I thank you for joining us again. Hope you got some water. Hope you got some carrot sticks. Hope you brought in your family, because the conversation tonight is all about stroke. Before the show, when we first started, I shared with you some statistics. Did you know that every 40 seconds, someone suffers from stroke? So I brought in the best of the best from Glendale Adventist Medical Center, the stroke medical director, Dr. Lance Lee, who's also a neurologist. Dr. Lee, you shared with us that it was pretty exciting to go from 3 to 4. You shared with us about a new medication called TPA. There are two types of strokes. Can you please share with us what those are?
So there are two types of stroke. One is the ischemic stroke, which means there's no bleeding. It is a dry stroke, we call it. And another type is a hemorrhagic stroke, when there's a bleeding in the brain. So the treatment would be very different, of course, depending on what kind of a stroke that we're looking at.
So let's talk with the first one when you say it's a dry stroke. So just say John Smith is sitting here and he suffers, you said an ischemic stroke,
Correct.
Which is a dry stroke. What happens to him?
Well, again, then now we're looking at the disruption of the oxygen and blood sugar
Okay.
going to the brain, which will result in a brain damage.
Okay.
So that is a situation that we're looking at. So brain will go into the infarct stage, which means it'll be dead.
Okay. With stroke, there's a saying, time loss is brain loss. How much time when someone suffers, because we'll address the second type of stroke, the hemorrhagic, how much time is it imperative for someone to go from their house, John Smith, from their house to Glendale Adventist Medical Center so there will be no permanent damage?
Well, the concept is sooner the better.
Sooner the better.
Sooner the better. Some people may think that, okay, I'm going to take my father or my mother to the hospital directly, but I don't think that is a smart idea. I think the calling 911 is probably the best idea, and I'll explain it to you later why.
Okay.
But in terms of saving the brain tissues from the stroke, getting to the hospital where they can treat you urgently will be the best choice.
And going back to, we had the ischemic and then the hemorrhagic is when you actually have a bleed in the brain. How does one happen over the other?
Well, the mechanism would be different. Usually it's caused by hypertension,
Okay.
poorly controlled hypertension, or there could be other sources like drug use. There will be congenital issues, aneurysm. I mean, there are a whole host of different conditions that can be associated with a bleeding type of stroke.
And also family history too. Yes.
Correct, correct.
And we've addressed this before we started, is signs and symptoms. Please break down for us what signs and symptoms are, because in the beginning I said the word fast.
Right.
So F is face. What should someone look for in regards to facial distortion?
In case of a stroke, you will see some facial asymmetry. So one face would be crooked or flat, depending, of course, how you describe it. So you will see the difference in shape of the face, and you will see the clear difference. Then that's the time to worry about the stroke.
So it'll be that maybe this side of my mouth is up, this side is drooping.
Correct.
So for you at home, if you think somebody's suffering from a stroke, first facial, fast. All you have to remember, the word is fast. The face looks different, you said, distorted or flat. When you say flat, what does that mean?
That means that brain controlling that part of the face is not working.
Okay, so it looks like you may have had a lot of Botox. However, it's actually flat, so there's no movement.
Correct.
The next sign is arms.
Right. You would have a patient to bring the arm up to see whether there's any drift or there's any lagging.
Okay.
Or just weakness itself.
So going like this, you're fine. Going like that, you're fine. Weakness or lagging meaning you actually need assistance.
Correct.
To raise
You cannot
the arm.
lift up, and there is definitely a clear evidence of the weakness of the one arm.
Okay, so it would just be one arm.
That would be the usual sign of stroke. Correct.
Is it left or right, or it doesn't matter?
It doesn't matter. It's
Okay.
50-50 chance for that.
And then speech. Share with us what that means speech-wise.
Well, you will have speech differences. It could be lack of speech, unable to articulate, slur speech, making no sense. And these are all sudden signs of speech disturbance we're looking at. Then we're considering stroke as a top differential diagnosis.
So, and I also heard that when the speech is impaired, there's a panic behind the eyes as well.
Correct.
Okay. Does one happen over the other? Does the face distort before the arms, or the speech, or does any of that happen?
The order could be random, but usually happens at the same time.
Okay.
So when you see the crooked face, you may see also a slur speech, and vice versa. Yeah.
And then what you then do is, and then T for fast, face, A, arms, S, speech, slurring or not being able to speak, and then T is time.
Right. Now you have to talk about the time factor, because you're thinking about stroke at this point. You have to get to the hospital where they can treat you urgently as soon as possible.
And when you say as soon as possible, what in a perfect world, somebody, John Smith, is having these symptoms. You do not drive your family member to the hospital. You call 911 and you make sure they take them to a certified stroke center like Glendale Adventist Medical Center. And you follow them. You also, one thing that I want to throw out there is, since the person that you love is suffering from a stroke, you follow them and you bring a list of their medications. You have to be the person accountable for the family history. More information is better for doctors like you, because if you don't know, you don't know.
Yeah, that would be critical, actually. Those are very critical information for the doctors to treat the patient. And if the family can help you with those kind of history, it's very, very helpful.
So you heard it from Dr. Lee. You need to have a list of your family history. You need to have a list of your medications and your emergency contacts. If someone you love is suffering from a stroke, call 911 immediately. When we come back, Dr. Lee will address why calling 911 is important. He'll share with us what TPA is, and we're going to share with you what you can do to prevent stroke. Now, here's another thing you can do. Stand up, stretch, take a few deep breaths in, and breathe out. And if you're on the phone, put it down. If you're on your computer, close it, because information like this can possibly save your life. Don't go away. We'll be right back. Take a deep breath in and a deep breath out. Thank you so much for staying with us. Our conversation tonight is about stroke. Neurologist Dr. Lance Lee was just addressing the importance of fast signs and symptoms of stroke: face, arms, speech, and time. Doctor, let's spend a little more time talking about time. Time loss is brain loss. What is that?
So the time is very critical here, because our main treatment for stroke, when we talk about stroke, of course, it is ischemic stroke, which is about 85% of the stroke volume.
No, the ischemic is the dry stroke.
Correct.
Okay.
So for you to treat that, we have to use TPA most of the time. Then there is a time limit for TPA. And TPA is a tissue plasminogen activator.
Okay.
And it is the really only treatment approved by the FDA for the treatment of the ischemic stroke.
And is that the clot buster?
That is correct. And there's a time limit for that particular drug to be used. The usual window is 3 hours for the ordinary population.
From onset of symptoms?
Correct.
Okay.
It's been extended to 4.5 hours to a certain subpopulation. So there is a time limit of what we can do for the patient. So the sooner the patient gets to the hospital, the better we can do for the patient in terms of the treatment. Now, calling the 911 helps, because when you call the 911, 911 will also communicate with the hospital emergency room. And they are informing the ER the patient is coming with the stroke symptoms. Then ER can get ready for the patient.
It then sets them up to, so it's triage.
Correct.
A stroke triage. True.
So that ER is already alerted, and they are getting ready for the patient much sooner than just popping up in the ER out of the blue. So it would be much helpful.
And that also, again, back to, you want to go to a certified stroke center like Glendale Adventist, because they know exactly what they're doing. And I'm not saying that hospitals don't know what they're doing, but hey, John Smith is coming in, boom, the masses connect, and you're ready for him.
That is right. In the county of Los Angeles, we do have the EMS diversion rule. So that if the patient has a stroke-like symptoms, then EMS really has to deliver the patient to the closest stroke center.
That's fantastic.
So that's been arranged, and it's been practiced for last
It's mandatory.
good 5-6 years. Yes. Yeah.
Now, earlier you said TPA, and then are the same procedure with the hemorrhagic stroke as well, or is that a different?
Hemorrhagic stroke would be a completely different issue, because the TPA promotes the bleeding. It is clot-busting drug,
Okay.
so it'll dissolve the clot. By doing so, you're going to have more bleeding tendency. So there is actually potential side effect of bleeding. So that wouldn't be the appropriate treatment for the hemorrhagic bleeding type of stroke.
What would be appropriate for the hemorrhagic stroke?
Hemorrhagic stroke, depending on, of course, the cause of it. If this is caused by the aneurysm, then there is a special treatment for the aneurysm. If this is caused by the high blood pressure, blood pressure actually caused the damage of the blood vessel itself. Then we just have to provide a supportive care and blood pressure control and intensive care. And sometimes surgery is life-saving at that point.
And also, at Glendale Adventist, you can do minimally invasive surgical procedures, true?
We actually have all capability of treating hemorrhagic stroke, including aneurysm repair, doing the craniotomy, which is opening the brain and taking the clot out type of surgery. And we have TPA, of course, and we have other technologies to help the stroke patients that are really cutting edge and state of the art.
So just say John Smith suffers stroke and he makes it within the window of 3 hours. And you said it can even be now up to 4.5 hours. What happens? Meaning, where is he at? Has he lost function in his arm or his left side? Is his speech permanently slurred? What is the outcome, or is each case different?
So the outcome could be quite different from patients to patients. But the overall picture is if you get the TPA, your likelihood to be in much functional state is higher. Of course, I've seen patients who did not respond to the treatment, but at the same time, I've seen patients who recovered almost miraculously to normal level of function.
And bottom line is the closest to onset of any signs and symptoms to get to a certified stroke center.
The sooner the better. If we can give the TPA as soon as possible, the outcome would be much better.
Doctor, what is TIA?
TIA is a transient ischemic attacks abbreviation. It is a form of a stroke. We call it mini stroke. That's a layman's term. It is a stroke that is cleared up completely, that you don't have any clinical symptoms.
Is that, so then there's 3 types of stroke: ischemic, hemorrhagic, and TIA.
Well, TIA is a
smaller version of
the ischemic stroke that is cleared up.
But does it still, is it the same thing as that it happens mostly to older people?
That is correct. And you were talking about, of course, people with the vascular risk factors. You talked about exercising and not smoking, and of course there's hypertension, there's diabetes issues. We can go on and on and on about all those vascular risk factors, but those are the folks who will get the, unfortunately, strokes, most likely so.
You know, doctor, you just listed diabetes and you said obesity. What are some other vascular risk factors?
Well, there are many vascular risk factors that causes a vascular disease. Of course, we're talking about here stroke, but hypertension.
What is hypertension, doctor?
Hypertension means high blood pressure.
Okay.
Uncontrolled blood pressure would be probably the most offending factor there. And then we have diabetes, heart disease, any kind of heart disease, irregular heart rhythm. Atrial fibrillation is a particular actually risk factor, which will increase your stroke risk by probably about 20 times more than general population.
Nice.
And then we're talking about smoking, hyperlipidemia, which means high cholesterol, high triglyceride.
Excessive alcohol, drug use, all of that.
Right. Lack of exercise, bad diet. We can go on and on.
You could go on, and you know, doctor, I also have to ask you when we come back, is if somebody does suffer from a stroke, what is the disability? Okay, so if you suffer from obesity, diabetes, bad diet, which most of us do, take a deep breath and just ask yourself, what am I going to do differently so I can put my health in my hands and be more preventative about stroke in my life? Do not go away. Welcome back to Healthline. The conversation tonight has been all about stroke. And joining me has been Dr. Lance Lee, Stroke Medical Director at Glendale Adventist Medical Center. Dr. Lee, just say someone suffers from a stroke. What is the disability then?
Well, the disability could be quite variable, but you may know that stroke is the #1 leading disability for age 50 or older in the United States. So it is one of the leading causes of the disability in that population. And
is it just because people are older and it's harder to rehab?
Well, that is true too, but this is a disease of part of aging.
Okay.
And your vasculature is being diseased, and you get a stroke as a result. And the disability could be quite devastating. As you know, a lot of nursing homes are for the stroke patients, unfortunately, and we're talking about losing entire body function. You're not able to talk, you're not able to write, you cannot walk, you cannot eat, you cannot communicate, you cannot see well. We're talking about major disability here. So the burden of the stroke is quite devastating if it hits you in enlarged, stroke area in the brain. So getting to the hospital is very, very important as soon as possible, and you should take advantage of our treatment that we can offer you.
If your intention with all of that was to scare us, you scared me a little bit. Here's the deal. Everything that we've given you today has been all about prevention. Doctor, prevention. Tell me about prevention. What can people do to prevent that from happening? Because when people are, 20, 30, 40, it's not going to happen to me. But stroke happens every 40 seconds.
Correct. So the stroke prevention happens over the weeks and months and years. It's not going to be an overnight event. If you're trying to prevent the stroke overnight, that's not going to work.
Good luck.
If you think you're going to come into the hospital and you're in the hospital that you're not going to get stroke, that is a wrong perception. Stroke can happen anytime to anybody.
At any moment.
And it doesn't discriminate anybody in that sense. So the way to prevent a stroke is that you have to do your job every day. You have to do the healthy diet, take the right medication.
What is, doctor, when you said do your job, healthy diet, what is our job with healthy diet?
Well, you're going to have to lower your red meat content.
Okay.
You're going to have to avoid a carbohydrate if possible, which will increase your blood sugar level, which will make you become more diabetic.
Okay.
You have to avoid smoking, of course.
Say no to it. I quit 9 years ago. That's I got to say. Thank you.
And then, of course, you have to do the exercise and make sure your cardiovascular system is always in a good shape.
Minimum 150 minutes a week for cardiovascular and working out.
That sounds very good. And if you can do daily, that'll be even nice. So exercise would be very helpful. And then, of course, you're going to have to take the right medications to control your blood pressure. Again, cholesterol is a big issue. If you can do it by diet, that'll be great. But there are a lot of medications out there to help you.
Doctor, since Glendale Adventist Medical Center is a certified stroke center here in the community, what are the services offered from that?
Glendale Adventist is actually Advanced Primary Stroke Center. We had that designation because we have the special capability. We can offer not only TPA, but we do have the capability to even go to the stroke site in the brain vessels to retrieve the blood clot if we need to. So this is a special technique that only a few centers can do in the country.
That's fantastic. And what happens with the stroke is you just basically need to, if somebody does suffer from a stroke and they end up surviving it and they go to physical therapy, they basically have to relearn how to walk, eat, and talk. What is the prognosis of that? Is it a month? Is it 3 months? Is it 6 months? How much is the physical rehabilitation for someone to get their health back?
The duration of the rehab period could be quite variable, but most of the recovery would happen within 2 weeks,
okay,
I would say. However, a lot of times up to 6 months, there is going to be some visible benefit from the rehab. So we do have the rehab service in the hospital that we provide for the acutely ill patients who need a lot of help. But at the same time, when they go home, they still need a help. So there's outpatient physical therapy that is going to be provided for the patients. Some people also, of course, need a nursing home care because their stroke is so devastating that then you need a 24-hour nursing care. Then you're going to get physical therapy from nursing home.
Doctor, what are your final thoughts on stroke? What do you want us to know?
Stroke, I think, is a really preventable condition if you know what causes it and why it happens. It's actually your lifestyle, and if you don't pay attention to your diet, you don't take your right medications, if you don't look at yourself, you own your weight, really it's going to hit you sooner or later. So this is a very preventable disease that you need to take care of yourself every day to prevent a future stroke.
Dr. Lee, thank you so much. So you just heard it from Dr. Lee, Stroke Medical Director at Glendale Adventist Medical Center. Stroke is a disease, and it can be preventative. Diet, exercise, less red meat, more greens, sleep, take your medication, live a happy, healthy lifestyle. If you or someone you love is suffering from FAST, Their face looks distorted. They can't lift their arms. Their speech is slurred. All you have on your side is time. Lack of. Time loss is brain loss. Call 911. Say someone I love is suffering a stroke, and let the professionals do their job. Have a list of medications, family history. Find out everything you need to know to prevent stroke in your life. Thank you for joining us, and you can always call Glendale Adventist Medical Center for anything you need. 818-409-8000. Remember, your health is the most important thing you have, and the most important conversation you're going to have is about your health. So why not talk about stroke today? Pass on this information to family and friends, and be the one that helps them get their health on. Have a great night. We will see you next time.